Today I am going to make the arterial system of whole lower limb. Here is this is our hip bone. Here is the pubic bone. Is the moustache like pubic arch. This is obturator foramen. Here is the iliac crest. This is iliac crest. This is the sacrum. Here is the sacral foramina. This is sacral foramina. Here is the acetabulum. This is obturator foramen. Here is the acetabular cavity. And this is neck of femur. This is greater trochanter. This is lesser trochanter. This is shaft of femur. Here is the medial condyle. This is lateral condyle. This is tibia. This is tibia. And here is the fibula. This is shaft of tibia. Here is the medial malleolus. And this one is the lateral malleolus. Here is the talus. And this is calcaneum. This is calcaneum. Here is the cuboid. This is the navicular. This is lateral cuneiform, intermediate cuneiform, and the medial cuneiform. This is the tibia. So this is the medial aspect. And here is the first metatarsal, second metatarsal, third, fourth, and fifth metatarsal. This is the great toe, so there are only two phalanges. In other toes there are three phalanges. 1 2 3 1 2 3 1 2 3. So, and this is sacrum, and here is the lumb L5, and this is L4. Okay, now at the level of L4 this is the aortic bifurcation, and at the level of sacroiliac joint this is the iliac bifurcation. Now external iliac, after crossing, here this is the pubic tubercle, this is anterior superior spine, this is inguinal ligament. So after crossing the inguinal ligament, this is our femoral artery. Here is the femoral artery passing medial to the femur. Okay, now this is our femoral triangle, and here is the adductor canal. This is adductor canal. At the level of the femoral triangle, femoral artery gives three superficial branches: superficial externopudendal towards the genitalia, superficial epigastric above, and the superficial circumflex iliac towards the anterior spine. And the deeper aspect, it is giving the deep externopudendal. One is the muscular branch, and another one is the profunda femoris, which passes in between the femoral artery and the femur. Just always remember this thing, that the profunda femoris in between the femur and the femoral artery. Now this profunda femoris giving on the medial aspect, this is the medial circumflex. Coming from the lateral aspect, this is the lateral circumflex femoral artery. And these two are the transverse branch, and one is ascending branch, ascend up to the greater trochanter. This is the ascending branch of the lateral circumflex. Okay, and now they are giving the four perforating, first, second, third, and fourth perforating artery, which gives descending and ascending branch, descending and ascending, then descending, ascending, descending, and ascending branch. Okay, now descending branch with the fourth perforating artery, anastomose with the main stem itself. And this is our internal iliac artery. Internal iliac artery, this it gives anterior division and the posterior division. One of the posterior division branch is the superior gluteal artery going on the posterior aspect, so I am showing in the dotted line superior gluteal, so superior aspect. And one of the branch of the anterior division is the inferior gluteal, I am showing in the dotted line. So this is the inferior gluteus. This is superior gluteal, and this is inferior gluteal at the inferior level. Now at the level of greater trochanter, this is the descending branch of the superior gluteal, and one is ascending branch of the inferior gluteal. Now these four arteries, that is the ascending branch of the medial and lateral circumflex, descending branch of the superior gluteal, and ascending branch of the inferior gluteal, all they combine to form This is our trochanteric anastomosis at the level of the greater trochanter. This is trochanteric anastomosis. Now these two transverse branch along with the descending branch of the inferior gluteal, and one is ascending branch of the first perforating on the lateral aspect of the thigh, it forms the cruciate anastomosis. And now this is the our main femoral artery which is passing into the adductor canal, and it is giving one branch, that is the descending genicular artery, which gives two branch, that is the articular branch and one is the saphenous branch. Okay, and here is the our femoral artery in the adductor canal, and this is adductor gap, after which it is renamed as the popliteal artery on the posterior aspect. So I am showing in the dotted line. The branches of the popliteal artery on the lateral aspect are superior level. This is the superior lateral, this is superior medial genicular, this is inferior lateral genicular, and this is inferior medial genicular. Superior medial genicular articulate with the articular branch of the descending genicular artery, and the inferior medial genicular anastomose with the saphenous branch of the descending genicular. This is superior lateral genicular, it anastomose with the, this is our lateral circumflex, one of the branch of lateral circumflex is the descending branch. Okay, so this is descending branch of the lateral circumflex femoral, it anastomose with that, and this is inferior lateral genicular which gives three terminal branch. Okay, and now this is popliteal artery divides into the anterior tibial and the tibiofibular trunk, which divides into the posterior tibial and the fibular artery. Anterior tibial, from the anterior aspect this is giving the anterior tibial recurrent, from the posterior aspect going to the posterior tibial recurrent as they are taking the backward course, and one of the branch of the posterior tibial is, this is the fibular recurrent, and they are anastomosing with each other, and whole of this is known as genicular anastomosis. Now this anterior tibial artery, it is at the level of the malleoli and up to the, as this is the medial side, this is lateral, so this is first intermetatarsal space up to here to here, this is the dorsalis pedis. At the level of the tarsus, this is the lateral tarsal artery, this is medial tarsal artery, and the continuation of the dorsalis pedis is the first dorsal metatarsal artery running in the first intermetatarsal space. Okay, now this first dorsal metatarsal artery, and one is forming an arch, this is arcuate artery, and one is going to the deeper aspect on the plantar side, this is the deep plantar, so I am showing in the dotted line. Okay, now this arcuate artery gives second dorsal metatarsal, third dorsal metatarsal, and the fourth dorsal metatarsal artery, which divides into each. The first gives two dorsal digital artery, again second gives two dorsal, then third, then fourth, giving the each giving the two dorsal dorsal digital artery. Okay, now this first dorsal metatarsal artery also gives one branch to the medial side of the big toe, and this is our arcuate artery is giving one branch to the lateral side of the little toe. Okay, so this is big toe, this is second, third, fourth, and fifth. Now this is in the dotted line, this is deep plantar artery, and this is our posterior tibial. This one is posterior tibial, which gives two terminal branch on the plantar aspect. This is on the medial aspect, this is medial plantar, and on the lateral aspect this is lateral plantar. Now this lateral plantar going to anastomose with this dotted line, this is deep plantar artery, and they are forming the plantar arch. So it is very important. Plantar arch is formed by the union of deep plantar artery, which is the branch of dorsalis pedis, and the branch that is the lateral plantar, which is branch of the posterior tibial artery. And this plantar arch, they are giving the first plantar metatarsal artery, second plantar metatarsal artery, third plantar metatarsal artery, and the fourth plantar metatarsal artery. Now each plantar metatarsal artery again gives plantar digital arteries. two plantar digital arteries. Plantar digital arteries and the plantar digital artery. This plantar metatarsal artery in the blue color, this is plantar metatarsal artery. It is interconnected with the dorsal metatarsal artery in pink color at the proximal level and the distal level by the perforating arteries. Okay. So, this is about the whole arterial supply of the lower limb. Thank you.